Hi, good day. I'm Dr. Dean van der Westhuizen, an eye surgeon working in Mbombela. And today I would just like to talk to you quickly about Meibomian Gland Dysfunction and its impact on dry eye. To start off with, I'd like to just explain to you that the tear film, which is a film of fluid that is over your eye, is made up of essentially three layers. There's a mucus layer, an aqueous layer, and then a layer of lipid. That lipid is almost like an oil layer on the surface, and that oil acts to stabilize your tear film. And by stabilizing it, it prevents evaporation, and as a result, that your tears stay in your eye and they keep lubricating, keeping your surface moisturized and clear and clean. The problem with Meibomian gland dysfunction is that production of oil decreases. These are called the Meibomian glands, and these glands produce oil that goes out at the Meibomian gland orifices. There's lots of small little holes where this oil is secreted onto the surface of the eye. And when we talk about Meibomian gland dysfunction, it's these glands that become dysfunctional, and so the normal oil production you get becomes thicker, more like butter than like oil. Here's an example of fine droplets of oil that can be seen on the eyelid. This is a normal eyelid with a normal Meibomian gland function. Here's an example of someone with severe Meibomian gland dysfunction. You can see that at all the Meibomian gland orifices here, they are clogged up and blocked, and as a result you don't get much oil going into the eye, and the typical symptoms of scratching, foreign body sensation, pain, discomfort, blurred vision, and tearing ensue. The main way in which we treat Meibomian gland dysfunction is with warm compresses and eyelid massage, and then to supplement your tear film with lubrication. There are a variety of drops, gels, and ointments on the market to help manage Meibomian gland dysfunction. Most of the time you're wanting to use a drop that is designed specifically for that, so something that has some lipid containing component versus something that is just for aqueous deficiency, which is a deficiency in the watery component. So choosing the right drop, as well as warm compresses and eyelid massage. Sometimes we need to add an oral antibiotic. Cortisone and steroid eye drops can play a role as well, but the mainstay is warm compresses and eyelid massage. The challenge with that is that it's something that needs to be done regularly at home, daily, but it is something that really can make the biggest difference. In very, very severe cases of Meibomian gland dysfunction, we may need to manually express those glands. Here's an example of the glands being manually expressed. Here you can see another example, and you can see that as the glands are expressed, there's this thick white secretions coming out of those glands. And then in very extreme cases, we sometimes will probe the glands to open them up to get them to resolve. In extreme cases, if this is not managed well for a long period of time, one can get scarring of the Meibomian glands, and if that happens, unfortunately a lot of the times those glands stop functioning, and that can be a permanent loss of Meibomian gland secretions, and as a result dry eye that is worsening and a heavy reliance on topical eye drops, gels, ointments, etc. I hope that you find this helpful. If you are interested in knowing exactly how to do warm compresses and eyelid massage, which is the mainstay of treatment, take a look at one of my other videos for a detailed explanation on how to perform that well. Thank you.